I'm joined by Yaning Yang, the clinic coordinator at Umbrella Multicultural Health Co-op. How are you today?
I'm doing well. How are you?
Wonderful, thanks. Please start by telling us a bit about Umbrella Multicultural Health Co-op, your services, and the community that you serve.
So we are Umbrella Multicultural Health Co-op. We're located on the ancestral and unceded land of the Kakat First Nation, or colonially known as New Westminster. And we provide family medicine services, social determinants of health services, health promotion, and mobile clinic services to immigrants, refugees, newcomers, and temporary farm workers who are experiencing cultural and language barriers accessing healthcare. We're a member-driven health co-op, and we employ the cross-cultural health broker model to deliver culturally appropriate care. The cross-cultural health brokers are bilingual and bicultural individuals who bridge language barriers, and they work with patients and participants from their communities to access medical services, social services, and health promotion activities. We'll also support the relationship between the patients and the clinicians. Currently, we have cross-cultural health brokers for patients who are Arabic speaking, Farsi Dari and Pashto speaking, Spanish speaking, and Tingrinya speaking communities.
Wow, that's amazing. I did not know all of that. That's very exciting. I'm curious though if you see any gaps in terms of individuals or groups that don't have access to services but would really benefit to access from a community health center within British Columbia or even in the closer catchment area that you work in.
Yeah, definitely. I think the individuals that we currently serve is definitely a group that have barriers accessing healthcare elsewhere because of language, because of the culture. And the gaps that we also see like more and more nowadays are actually for individuals and groups who do not have MSP or other forms of health insurance. So we serve clients without health insurance, and oftentimes they also experience having low income, housing instability, food insecurity, and other social barriers. And all of these factors compound in a person's life and they contribute to poor health outcomes. And our team has been really tirelessly working with community partners to find solutions for this client population. So, for example, like finding low cost resources or using our very limited funds to support medication needs, laboratory investigations, or partnering with specialists who do pro bono work, volunteers, and advocating with hospitals for bill forgiveness, so on and so forth. It's often very time consuming, and my team is like very resourceful in finding ways to support this client population. So yeah, this population I think would really benefit from having access to community health centers that can advocate for their needs and help them navigate the system.
Absolutely. Um, all of that being said, the pandemic, which affects, so many of the people that you described, which is why I'm really excited to hear what you have to say. It was such a difficult time for many of the community health centers to adapt and continue to meet the needs of their clients. But every single community health center I've spoken to has persevered. Can you speak to the impact that your community health center helped make during the past almost 3 years now of this ongoing pandemic and how you helped serve those communities you were speaking about?
Sure. During the past 2, 3 years, we have actually expanded our services and we've incorporated virtual health technologies to make sure our patients and community members are able to access care and health information. I think during the first year of the pandemic, we translated weekly health updates regarding COVID-19, like quarantine, isolation policies, travel restrictions, testing, vaccination efforts, into all the 4 languages that can be easily digestible for our community members. And our cross-cultural health brokers also called patients and family members on a weekly basis to check in on their well-being. And we also organized food basket drop-offs for seniors and pregnant people who are at risk of food insecurity and also COVID infections. From our service data between April 2021 and March 2022, I found that annually our family medicine team had over 1,000 medical consults, and we had over 200 social determinants of health worker appointments and over 4,000 cross-cultural health broker appointments, where we provided health system navigation services, language and cultural interpretation, COVID-19 information, patient advocacy, and emotional peer support on topics like integrating into the Canadian society, family matters, finances, housing, education, the immigration journey, and employment. And our mobile clinic team also had over 300 medical consults and supported over 400 temporary farm workers with health system navigation, including managing their WorkSafe BC cases, COVID testing and vaccination support, and advocating for people with insurance and service agencies. And we hosted 4 low barrier COVID vaccine clinics in partnership with Fraser Health Outreach Team. And we vaccinated 500 individuals, with over 50% of them being their first dose. And many of the people who came to us, to our vaccination clinics, needed language interpretation and also assistance with registration in the provincial system and getting the vaccine certification, the vaccine verification. And our health promotion program continued virtually throughout the pandemic for our U Babies and U Seniors program to help community members connect and reduce social isolation during the pandemic. And annually, we hosted 20 to 30 sessions in each program, and with group sizes ranging from 10 to 20 participants. Some of the topics included mental health awareness, maternity health, healthy behaviors and preventative care, and also geriatric health topics. And we also kickstarted our health promotion workshops for all 4 of our communities. And we delivered monthly workshops on topics of healthy eating, exercises, women's health, mental health, health system navigation, diabetes, hypertension, chronic diseases, with attendance ranging from 20 to 50 participants per session. So overall, I think we not only persisted in the pandemic, but actually expanded our services via team building and outreach and partnerships with our with other service agencies.
Yes, certainly did. And that's it all so incredible to hear. And for anyone else who's interested in another summary of that, we have featured Umbrella Multicultural Health Co-op in our COVID-19 vaccine promotion and provision across Canada case studies from community health centers, which launched this October. So that is on the website. I will put the link in our YouTube description, but you are featured amongst many other of our community health centers, which was really exciting to see. Exciting to hear as well. So there so much going on, but it's a recurring theme. But that's amazing that you're able to reach and impact so many people. Umbrella Multicultural Health Co-op operates a number of services and programs that focus on people's determinants of health beyond healthcare, as we've described, like the social determinants of health, early years supports for children and parents, and other upstream supports. Do you see particular areas where increased federal investment in community health centers would enable you to increase your reach and to further improve the health and well-being in your community?
I think in the case of Umbrella, I think we have been advocating for increased investments in our cross-cultural health broker model, where the relationship building and trust and bridging the language and culture barrier have been the most effective way of engaging with our client population. So without the cross-cultural health brokers, we wouldn't be as effective in delivering all the services to our patients. And currently, our attachment and service capacity is limited by like our cross-cultural health broker capacity. And we keep getting calls and referrals from communities, from other agencies and hospitals on a daily basis requesting assistance for people who meet the demographic criteria for our attachment. And it has been very, very difficult and heartbreaking to have to turn people away more often than not. So really, I think that where we can really benefit from investment is the capacity to build trusting relationships with marginalized populations and communities, and really listening to their voices on what they need, like how they need support. Yeah, and that's kind of where coming from Umbrella, that's what we have been advocating for.
Amazing. That makes a lot of sense. And of course, those communities will share and express what their needs are. So I think that's great. And the work you did during the pandemic was wonderful. I want to thank you so much, Yanning, for taking the time to speak with me today.
Thank you.